New report focuses on the children who rely on the program. Hi, everyone. I'm Stephanie Cruz.
And I'm Ty Steele. Tonight, the state is looking to step in, and Fox 40's Joe Khalil joins us live from outside the Capitol. And Joe, what's the issue here?
Well, Ty, there are a number of issues. A lot of dentists won't even see Denti-Cal patients. They make less money when they do. Others, even if they do see those patients, they can't meet the needs of them, especially when it comes to children with special needs. That's why there are so many kids that aren't getting the care that they need. 7-year-old Evan Alexander is autistic.
I love you.
He suffers extreme anxiety, which, as his mom Erin says, makes doctors and dentist visits extremely tough.
I've called Denti-Cal several times, told them what my son needs, and they kept referring us to places that couldn't see us.
Without Denti-Cal, the Alexander family would have to pay close to $1,200 out of pocket per visit. But Alexander says finding a Denti-Cal dentist who can work with special needs patients isn't easy. This folder full of places that won't see her son.
And they either didn't see special needs kids, didn't take the anesthesia that he needed, or were so far away that my son couldn't physically handle driving there.
Evan is one of 2.5 million kids eligible for Denti-Cal dental care who hasn't gotten any care at all.
So you have more and more people becoming eligible. At the very same time, you have fewer dentists that want to take this.
Carol D'Elia is the executive director of the Little Hoover Commission, an independent state entity lawmakers have asked to review Denti-Cal and come up with ways to improve its services. D'Elia says dentists don't have any real incentive to treat Denti-Cal patients like Evan.
Reimbursement rate per providers in California is about 30 cents on the dollar for what they would get from the commercial sector. So,
not to mention the extra certification and paperwork. Certain counties have very few Denti-Cal options. Others, like Amador, have none. D'Elia says more state funding might be part of the solution.
But how much money? We don't know. What would be the magic number? Does anyone know what that is? Has anybody studied it?
Just some of the issues the commission will take up. Denti-Cal officials say they welcome the review.
And it helps to make us more accountable to the program. It's probably hard for me to say what it will look like. I think that there will be some changes, but change does take time.
Renee Malo says their goal is to help those 2.5 million kids eligible for Denti-Cal use it. No one more hopeful that happens than Alexander. And, you know, this is really just the beginning for the Little Hoover Commission, the group that's looking into Denti-Cal right now. They're looking at funding issues. They're looking at better ways to connect dentists with patients. They're looking at even what other states have done, but certainly quite a lot of work left for them to do to make sure that everybody gets the care that they need. Reporting live in Sacramento, Joe Khalil, Fox 40 News.
Thank you.